Hello, everyone. My name is Larry Schwartz. I'm the CEO of GigFlex, a company based in Cincinnati, Ohio, here in the United States. And I'm pleased to have the opportunity today to present to you how Geo-Intelligent scheduling can address today's home healthcare staffing challenges and bring back home-centric patient care. My background has primarily been in enterprise software. I do have a number of patents in intelligent intraday automation and intelligent self-scheduling, to my credit. So let's go ahead and get into the presentation. The topics I'm going to cover today are really four key things. I'm going to talk about staffing challenges in home healthcare, primarily focused here in the US, although I think it's applicable pretty well around the world. I'm going to talk about scheduling empowerment impact on recruiting and retention, how Geo-Intelligent scheduling can deliver scheduling and power for both schedule administrators and for nurses, and finally, how Geo-Intelligent scheduling can bring back home-centric patient care. My presentation is largely based on articles that have been published in a number of publications, including Home Healthcare Now, CIO Review, and SWPP on Target. So there really has been an unprecedented growth in home healthcare here in the United States. Every single day in the United States, there are over 10,000 adults turning 65 years old. And most seniors prefer to live in their own homes, according to the US Census Bureau. COVID-19 and the fear of future pandemics is really exacerbating this trend and making it even more so that people want to stay at home and out of the hospital or nursing homes. The number of home healthcare workers in the United States is projected to grow from a little over 3 million, which is about 2% of the US workforce, to almost 4.5 million between 2018 and 2028. That's a 36% growth. But home healthcare turnover in the United States is averaging around 22%. And if this 22% annual turnover trend continues, the total number of home healthcare hires needed, meaning people that actually have to get hired between 2018 and 2028, will total almost 10 million people. So that's obviously putting a huge strain on the home healthcare industry here in the United States. According to a Home Healthcare News Staffing Report, which was published in 2019, they took a look at what are the key impacts of this problem. And almost all of the respondents of the survey said that staffing challenges have impacted their ability to grow. In other words, if they got to find more people to hire, they would hire them, but they can't find enough people to keep up with the demand. Almost 75% of respondents said staffing challenges have impacted their organization to ensure compliance. This is in terms of meeting regulatory requirements relative to things like documentation and things, as they put a lot of strain on the staff. And almost 90% of the respondents said that staffing challenges have impacted their organization's ability to improve patient outcomes. They just can't spend the time with the patients because there's just not enough staff to go around. When you look into what's underlying these issues a little bit deeper, it tends to fall into four categories: staffing and scheduling complexity, improving nurse utilization, improving patient and nurse satisfaction, and finally, nurse recruiting and retention. So I'm going to go a little bit deeper into these four areas over the next few slides. First of all, in the area of staffing and scheduling complexity, if you think about the traditional staffing challenges of hospitals, clinics, doctors' offices, home healthcare introduces this key new dimension, which is location. The distance from the healthcare worker to the patient at the time of the appointment. Issues like, does the worker have a reliable means of transportation? How do I compensate the nurse for travel time and distance from the patient appointments? Their salary relative to comparable in-building positions. And finally, electronic visit verification, which is a regulatory requirement here in the United States and maybe requirements in other countries around the world, essentially verify when the nurse showed up at the home and when they left. The second area is improving nurse utilization. And here, when you start getting into the routes that the nurses have to take to go from appointment to appointment, and if you think about it, if home healthcare nurses could average 7 appointments a day, say, versus 6, which is kind of the average right now here in the United States, that would translate into a capacity improvement of 16.7%. Or a better way of thinking about that maybe is to think about, for a 300-person organization, that'd be like getting 50 additional workers at no additional cost. So obviously that could have a huge impact. And then providing a means for salaried workers to meet the number of appointment quotas is important. So if you're a salaried worker, typically you're getting paid whether you see one patient or 100 patients in a week. And so typically a lot of companies will say there's a minimum number you need to have in your schedule. And Obviously, you need to provide your nurses with the means to track their compliance, see how they're doing, and provide nurses with the means to achieve their quota, which means being able to show them opportunities as they arise, which is kind of pushing them to the outward to the nurses so they can see them, or actually enabling the nurses to go into a system and self-schedule, see appointments themselves, and actually self-schedule, which is more of a pull approach. The third area is improving patient and nurse satisfaction. This is things like enabling nurses to get real-time notifications of changes in their travel time if traffic conditions get worse, and what's the best route to get to your next appointment. Identifying optimal scheduling alternatives. So if a nurse can't get to the next appointment on time, maybe can I find an alternate nurse, and taking into account their skills, distance to the patient, past patient experience. How do I communicate to the patient if there's changes to an appointment time, or if a different nurse is going to be showing up at your home? How do I make sure that happens so a patient's not confused as to why their home healthcare nurse didn't show up at 2 p.m. or a different person who showed up that they weren't expecting? Communicating the patient environment information is also important for the nurse, knowing which door should I enter the home, and is there a dog there or not, things like that. And then finally, in the area of nurse recruiting and retention, one thing that's kind of important to look at is what's going on with the underlying demographics of the workforce. And I'm showing here a study from Pew Research Center that was done a couple of years ago that shows that in 2016, millennials actually became the largest workforce generation here in the United States. And I think that's trending pretty much similarly around the world. And in health services back in 2017, it represented about 40% of the overall population of home healthcare workers and health services workers in general. And when you look at the United States did a millennial research study looking at millennials' attitudes, and interesting things that came out of that study is most millennials consider scheduling empowerment more important than opportunities for pay or career advancement, and almost 75% said scheduling empowerment was a primary driver of their career choice. And so why is that so important? We wanted to take a look at that, and we actually sponsored a study in conjunction with the Society of Workforce Planning Professionals across their membership, which represents lots of companies across lots of industries, many in healthcare, as you can see from this list. And the focus of the survey was really looking into the scheduling empowerment area. And if you want to define scheduling empowerment, it's the things here on this list that you see in front of you, things like ability to see your schedule anywhere, anytime, say from a mobile app. Being able to predefine interest periods for when you want to work extra hours or when you might want to be offered time off. Getting alerts for schedule change opportunities that might be of interest to you so you can select them, and automated approval of ones that you do select with minimal delay, or if you request things, that making sure they get approved quickly. Taking time off or adding time to your current schedule, taking time off, making up another time, swapping schedules with coworkers. So you kind of get the idea of what we mean here by scheduling empowerment. So let's take a look at the survey results. This first question was looking at retention, and sort of the question is, if you're currently making $15.25 an hour, would your employee actually be willing to take a pay cut in return for scheduling empowerment? And when I show people this question, they'd say, well, who would take a pay cut for scheduling empowerment? And it was actually very interesting in the study that a third of the companies said that their employees would accept an average pay cut of 2.5% in return for scheduling empowerment. That's quite interesting. And the second question was looking at recruiting, which is the other half, saying, what are the following options would improve your recruiting success? And there's a bunch of options around paying, 5 to 10% more an hour. And then the last option was keeping the wage the same, the salary the same, but offering more scheduled change empowerment. And again, if you take a look at the results, about a little over a third of the companies said their employees would prefer scheduling empowerment over a starting salary increase of 5 to 10%. When you look at this from an employee perspective, asking the employees themselves questions around, is schedule change empowerment more important to you than pay or career advancement, or would I change employers for the same pay but more scheduling and change empowerment? You can sort of see here that schedule change empowerment is actually a more powerful recruitment incentive than wage rates. It's actually was fascinating to see that. So for companies that are looking to improve their their ability to recruit, maybe look rather than struggling over how I can offer a higher pay, maybe you should be looking at also, at least in the mix, offering scheduling empowerment. And this final question was actually quite fascinating as well, that if you're looking at, what's your ability to recommend your company as a place to work, and said if you offered higher level schedule change empowerment, 68% of the employees are more likely to recommend their company as a place of work if you offered more scheduling empowerment. And almost half of them said they would stay longer at their company if they had a high level of schedule change empowerment. And of that 47% that said that they would stay longer, 8 out of 10 of those, almost 8 out of 10 of those have said they would stay more than 12 months longer. So that's kind of the study results. And if we take a look at from the Home Healthcare New Staffing Report that I showed you earlier, so where are the areas of investment going on right now to improve staffing success? And they tend to fall into 3 key areas: training, incentive programs, and improving scheduling. And the good news is that almost 4 out of 10 companies are looking at using technology to address their staffing and scheduling challenges. So let's take a look at what we mean by scheduling systems and what kind of what's out there and what can be done. There's really 2 major types of scheduling systems. There's appointment-based systems, which you can think of as like your Outlook calendar. This is the kind of the system of choice for most hospitals, home health care companies, most businesses in general, where schedules are basically assigned well in advance. And a good example of this might be post-acute care, where somebody has a surgery and then they get 6 weekly home health visits from maybe Tuesday afternoon at 10 o'clock or 2 p.m. or something like that. And, exceptions are typically managed manually by the administrator. So if a worker calls in sick, they have to figure out who they're going to get to substitute for that, or whether they need to cancel the appointment, etc. And the second type of system is dispatch-based. This is what you're probably most familiar with, used by police, fire, emergency medical technicians, EMTs. It's more of a real-time system where, if somebody gets hit by a car, a call comes in, they need to dispatch somebody right away to that location. So they're not really scheduled in advance. And those are the 2 main systems. When you look at what's really needed in home healthcare, it's you really need kind of elements of both of these. And I call it sort of intelligent intraday automation, where you're overlaying real-time scheduling, this dispatch capability, over your appointment scheduling system. And this has actually been very successfully done in the contact center industry, which roughly has the same number of workers as nurses here in the United States. And the way that worked was you had automatic identification of staffing variances in the contact center going on based on changing call volumes and staffing levels. And it actually empowered the workers with the ability to adjust their schedules through a mobile app. And the workers alone adjusting their schedules were actually help the companies that were using this technology reduce their staffing variances by over 50%. And this is, there's about 250,000 agents here in the United States using this today. And if you look at this for home health care, this intelligent intraday automation could be very helpful, but, looking at what it would need beyond what is done, for example, in the contact center, you really need to take also additionally into account this location dimension, which is what we were calling Geo-Intelligent scheduling. So how would this work? Again, you would look at overlaying this over your existing appointment scheduling system. So it's sort of an augment versus replace. It would read schedules from your existing system and then write them back into your existing system. It would help you optimize your schedule routes and the tracking of appointment arrival and departure times, which could help reduce commute times by up to 35%, according to, with reference to the home healthcare article. Real-time traffic monitoring could be done to identify appointments that are at risk, so you could notify nurses when they need to leave to get to their next appointment. You could help them get to see the best route to take based on current traffic conditions. If a nurse can't make it to the next appointment, you need to find an alternative. It can help you automatically identify an alternative nurse to head out to that house based on configurable parameters like skills, distance to the patient, and number of hours they've already worked. You can have automatic patient communication of changes to the appointment time or assigned nurse so they don't get caught off guard. So this would be a kind of real-time exception messaging. And then finally, and last and probably very important, is the self-scheduling empowering, enabling nurses to see open appointments that they're qualified for and give them the ability to self-select them. So let's take a look at how this Geo-Intelligent scheduling could work, first from a schedule administrator perspective and a home healthcare nurse perspective. And we'll start with the scheduling administrator, looking at a use case of, let's say a nurse called in sick and there's an appointment that needs to be covered. So here's a kind of an administrator screen. You can see out here in time at 2 o'clock, it's looking kind of red here, indicating there's an issue. When you click on the patient, it shows there's no nurse assigned to that patient, so it's kind of a red condition. So the administrator could go in and literally click to say who is qualified to take that job. In other words, they're not working on another job, they have the right skills, they're not too far from the patient, they find one here, they just simply select that, and you see instantly that it goes from being a red condition now to a green condition because now there's a worker assigned. So it becomes very simple to address future issues. Now, if you look at it from a nurse perspective, this is a example of a mobile app where they're a salaried worker. They can see their appointments for the day, and they can also see their quotas for the, they need to do 6 appointments a day, and they need to do 36 for the week. And they say, hey, I'm short 1 appointment. How do I get another appointment? So I can make my quota. It's literally, they can go in and say, what are eligible appointments that meet my skills and distance requirements and things like that. The system will automatically show them, here in example 3, that would fit their criteria. The nurse picks one, they confirm it, it's done, and now they can immediately see that they now have their quota covered, as opposed to where they were before when they only had 5 out of 6 covered. So very quickly, to sort of give you a flavor of how the power of how this technology can really empower nurses with self-scheduling empowerment. So the last topic I'm going to cover is how Geo-Intelligent scheduling can bring back home-centric patient care. And what I'm going to do is start by sort of sharing, what's been going on here in the United States over the past almost century, I guess. When you look at the percentage of house call visits in the United States, in the 1940s, it was over half. Over half the patient-doctor interactions were in the patient home. And that significantly declined to the point where by the 1980s, it was less than 5%. There's probably 2 major drivers for that. One was the increase in insurance reimbursement and the policies around that discouraged doctors from visiting patients in homes, as well as the inefficiencies associated with that from a doctor perspective. As everyone knows in the world, something came along in 2019 into 2020 called COVID-19, which sort of made a huge impact on all of us. And one of the things that it really impacted was telehealth. In other words, these telehealth visits, which grew by 6,000% in the United States, where people really didn't want to go into a doctor's office. They wanted to see somebody remotely. The reimbursement here in the United States from Medicare, Medicaid got better. And now you can see it's even projected to quadruple again by 2026. So it's really, really growing fast, but it's really not the answer. I think from a patient perspective, if I take a look at, as a benchmark, take a look at a typical doctor's office visit, how that workflow works, which is kind of like the industry standard now. A patient calls the doctor's office, schedules an appointment, they go into the doctor's office, they commute in. The first thing that happens is a nurse does a pre-screen, takes their temperature, weight, blood pressure, confirms their history, why they're there. Then the doctor comes in, examines the patient, and then the doctor may order some post-appointment tests, like a blood test, a nasal swab. Nurse comes back in, takes the blood test and the nasal swab, so they send it off to the lab. Patient goes home. Eventually, the lab sends the results to the doctor's office, and the doctor's office calls the patient with the results. So it's a very high-quality care model, but it obviously introduces a lot of commuting inconvenience for the patient. Now, if you take a look at, contrast that with telemedicine, it starts again with the patient calling the doctor's office, scheduling the appointment. In this case, they just join a video conference, so they're still at home. But the first issue that pops up is, how do I properly do pre-screening? How I can't really necessarily always be able to take the temperature, weight, blood pressure, because patient may not have that equipment in their homes. So that may be somewhat compromised. And then if the doctor joins the interview and wants to schedule a blood test and a nasal swab, then the patient actually has to go commute to a clinic or something to get that done, which to some degree defeats the purpose of the videoing in the front end, because now they still have to go into a physical office. They go back home, and eventually the results come back in, and they get that. So there's, with the telemedicine, it's good for certain things, but it doesn't necessarily address some of the pre-screening issues and post-appointment challenges that are there. So then finally, if you take a look at, how an integrated home healthcare telemedicine model could work, where the patient stays at the home the whole time. This is something that can really be enabled by Geo-Intelligent scheduling. Again, the patient will call the doctor's office and schedule an appointment. But in this case, now that we know that there's an appointment coming up with a teledoctor, they can dispatch a home healthcare nurse to the home to do the pre-screening. And that gets done in the home, and the results get sent to the teledoctor before the appointment, so that when the patient joins the video conference, the teledoctor has all that information. And in this case, again, they might schedule a blood test and a nasal swab, but instead of the patient having to go to a clinic, we can dispatch a nurse to go to the home and take those samples and deliver them to the lab, again, through Geo-Intelligent scheduling. And then, the results come back to the doctor and they call the patient. So in this case, you're getting the best of both worlds. You're getting the high quality care you get from a doctor's office visit with the convenience of the patient being able to stay at home the whole time. So that's something that I think is really the future. If it's going to be driven certainly by patient preferences, this is where the industry really should be heading. So if your company is looking at, or your hospital or enterprise is looking at Geo-Intelligent scheduling technology, I just thought it might be nice to provide a little checklist of things to look for if you're considering adopting some technology. I'm not going to go through the entire list, but I thought I would leave it here for you. It's things like, does it integrate with my electronic medical record system? Does it enable administrators to easily communicate with nurses in the field? Does it automatically record appointment time and arrival and departure times? And does it give the nurses a mobile app that enables them, empowers them to essentially self-schedule and easily communicate with people? So these are just some of the things I will leave with you to take a look at. If you're interested in additional references, there's, again, as I mentioned at the beginning, these are based on a number of articles that were published over the last year or so, one in Home Healthcare Now, another one in CIO Review, as well as a lot of the survey results were from the SWPP survey, which was done back in 2017. And with that, I guess I can open it up for any questions you might have. You can get additional information on this stuff from our website as well at www.gigflex.com. Thank you. I appreciate your time.